Good afternoon, everyone. I can advise the ACT has recorded 2 new COVID-19 cases since yesterday evening. This brings the total number of active cases to 6. We've had more than 3,900 people identified through the Check-in Canberra app as either close or casual contacts. We continue to work through the detail of each of those cases, and 1,862 is the current number of close contacts who are associated with this outbreak. This work continues to go through the Check-in Canberra data for each exposure site, and so it is likely that the number of close contacts will increase. It was obviously a significant number of people coming forward to be tested yesterday evening. More than 2,000 tests have been conducted. So far, we have received back the results on about 1,330 of those, 1,330 negative tests, together with the small number of positive tests that lead to the outcome of these 6 active cases at this time. Now, we understand that there have been significant waiting times associated with testing. As we work through the exposure sites and parts of the community that are at most risk and we have the greatest need to get tested, we will be standing up additional testing capacity. Right now, we are asking those who have been contacted by ACT Health as a close contact and anyone who has symptoms to come forward for testing. Now, we understand that there will be many people who are anxious and want to get the peace of mind of a negative test result. But the priority right now is to test the close contacts and anyone who has symptoms. We will be expanding testing capacity, hours of operation, and the number of people that each existing testing centre can manage in a day. But yesterday was our all-time record number of tests. We expect today will be even busier, and we've stood up additional testing capacity. So please, if you do not have symptoms and you are not an identified close contact, you do not need to be tested today. Please stay at home. There will be an opportunity to be tested in the days ahead, but the priority right now is to test those people who ACT Health have contacted. This is important so that we can identify the close contacts, whether they're positive or negative, and get further information to our contact tracers around potential additional exposure sites. We will be regularly updating our website to provide the community with information on any new identified exposure sites. And Dr. Coleman will provide some further information on what we've learnt since our last press conference here 24 hours ago. In terms of business and individual financial support, we have been able to reach agreement with the Commonwealth Government for a range of support measures consistent with every other Australian outbreak. So COVID disaster payments will be available for people who have lost work as a result of the lockdown. Exactly the same way as in New South Wales, Victoria, Queensland and South Australia through Services Australia and MyGov. Similarly, we have reached agreement with the Commonwealth Government on a business support package. Again, the same methodology and approach as was adopted in the recent South Australian 7-day lockdown. Information for businesses is available at the ACT Government Business Hub. That is a link off the ACT Government website. We will be providing a range of support for businesses and individuals. We recognise the impact of the lockdown on individuals and businesses. The business support measures, as has been the case with other jurisdictions, are funded 50-50 between the Australian government and the ACT government. This has been a challenging period for Canberra, but the response to the lockdown today has been very good. I want to thank Canberrans for doing the right thing and staying at home. As I mentioned yesterday, the virus only transmits between people when you come into close contact with each other. So the reason for the lockdown is to avoid that sort of interpersonal contact as much as possible. It's been somewhat frustrating and disappointing to see so many people seeking to access supermarkets yesterday afternoon. I want to reassure the community that supermarkets and essential supplies will remain open every day through the lockdown. So there is no need to panic buy. You can get what you need each and every day during the lockdown. But we ask again that you go in, shop for what you need and leave. We want to reduce any risk to workers in our supermarkets who are working incredibly hard to keep the shelves stocked so that we can access the groceries and supplies that we need. But there is no need to panic. The shops that provide essential services are open every day. Now, it's going to be a quiet weekend in Canberra. Very quiet. We need people to stay at home. 1 hour of exercise outside with your household. If you live alone, you are able to identify one other household, one other person to be your bubble buddy for this time. But overall, what we need is people to stay at home, to not mix with other people. Now's not the time to pop over and see mum or dad, or your cousins, or your brothers and sisters, or your mates. Stay at home. Do the right thing by yourself, your family, and this community. Together we'll be able to get through this if everyone does the right thing. I'll now invite Dr. Coleman to provide some further information on the overnight cases. Minister Berry and Minister Stephen Smith will then provide updates, and then we're happy to take questions. Thank you.
Thank you, Chief, and good afternoon, everyone, again. So as the Chief Minister has advised, in the 24 hours to 9 a.m. this morning, we have recorded 4 new cases of COVID-19. This brings the total number of cases connected to this outbreak at 9 a.m. this morning to 5. These numbers include the 3 cases that were announced yesterday afternoon, all of which are connected and linked to the case, and another case which came through later last night, which is also connected to a close case. So just to be clear, all 5 of those additional cases are linked to the primary case. We have had an additional case recorded after the 9 a.m. reporting cutoff. This is a student at Gold Creek School. We have no identified links for this case at this point in time, so no known travel history and no identified link to the current exposure locations. This case will be reported in tomorrow's case numbers. So how we manage our case numbers and reporting is that we have a 9 a.m. cutoff. So if we officially receive the results before 9 a.m, they go in that day's reporting. If they aren't received until after 9 a.m, they officially go in the data the following day, but we may choose to talk about them if we have enough information to you during the press conferences. While interviewing is progressing with this school student, what I can tell you at this stage is that the student was infectious and looks to have been at school from Monday the 9th to Wednesday the 11th of August. We have been planning for this We know what to do, so now we are doing it, and we are working with the Education Directorate to do this. We are communicating very closely with the school community today. We will be treating all staff, students and visitors who are at the Gold Creek School from Monday the 9th to Wednesday the 11th as close contacts. This means that these individuals will all need to go into quarantine immediately for 14 days and do what we're asking everyone who is identified as a close contact to do, which is get tested and complete our online declaration form. Because this is so serious, we are also identifying household contacts as secondary contacts. And at this stage, the secondary contacts or household contacts will also need to be quarantining. This also impacts on the Holy Spirit Catholic Primary School, and Deputy Chief Minister Berry will be able to give you further information about both the impact and the response for Gold Creek and the Holy Spirit schools. But I do know that this is incredibly anxiety-provoking for some people. I mean, the first time we have a school involved can be very, very nerve-wracking. But I do want to assure you that we have done a lot of planning. We have spent our time over the last 18 months very, very productively, and we are swinging into our action with our pre-done plans. Just before I finish up today, I thought I would take you through the new exposure locations that we have. So since the last time I spoke to you, we have a new exposure location identified in Fyshwick, Pellegrino's Cafe, number 749 Wollongong Street, on the 10th of August from 7:15 to 8:15am. Again in Fyshwick, Windsor Smith at the Canberra Outlet Centre, Canberra Avenue, on the 8th of August from 2:45pm to 3:15pm. And then on the 8th of August again, from 8pm to 9:30pm, the Assembly, the People's Pub, 11 Lonsdale Street in Braddon. Additional casual contact sites include some in Gungahlin, Kmart in Gungahlin on the 10th of August from 3 to 4pm. And again in Gungahlin on the 10th of August, Big W, from 3:45 to 4:30pm. And finally, two additional sites in Deakin on the 11th of August. The same site, one additional site in Deakin, the EQ Cafe and Lounge at 70 Kent Street from 6:30am to 4pm. So please, we will be updating the exposure site list officially twice daily. So please check during both of those time periods. But if there's anything important that we need to get out prior to that, we will do that and let you know. Thank you.
Good afternoon, everyone. I'm just providing an update here following on from the Chief Health Officer's advice that a 14-year-old has tested positive at Gold Creek School in Gungahlin. People in Gungahlin will know that Gold Creek has two campuses, a junior and a senior campus. There is also an out-of-schools hours care program and a early childhood centre, Nichols Early Childhood Centre, which is also connected to the school, as well as Holy Spirit Catholic Primary School, and there has been some construction work happening at that Gold Creek site as well. So what this means is that the Chief Health Officer has advised that all students, staff, visitors and families at Gold Creek School, at the out-of-schools hours care service, at the early childhood centre and the construction workers are all considered secondary contacts and need to get tested and immediately quarantine. By families, we mean people who live in the same household as students or staff at these schools and at the early childhood centre, the out-of-schools hours care, and as well on the construction sites. For the Holy Spirit Catholic Primary School, these are considered as casual contacts. They share services within the Gold Creek Junior Campus Library as well as some other facilities. Those facilities are all being cleaned at the moment and all impacted staff and families are being contacted today through the Education Directorate, working closely with ACT Health. So for the families at Holy Spirit Catholic Primary School, as I said, they are considered casual contacts and they will need to be tested and quarantined as well. We have been working very carefully with these school communities to make sure that they are all supported, that the school staff, teachers, school principals, students, their families and households are all being supported during this time. And as the Chief Health Officer says, we have been planning for a scenario like this to occur. And so we are taking action and working through our plans to make sure that we are meeting the COVID safety requirements that the Chief Health Officer advises us to, and making sure that everybody in the school, those school communities and those attached communities are being supported and provided with all of the information that they require. So we'll have to take some questions later on, but Rachel Stephen-Smith, the Minister for Health, is going to come and just give a bit of an update on testing.
Thanks very much, Yvette. And good afternoon, everyone. I'm Rachel Stephen-Smith, the ACT Minister for Health. So just wanted to add a couple of comments to what the Chief Minister has already said in relation to testing. First, I do want to apologise to those people who were sent home from the EPIC testing site yesterday evening. We did think when we closed the gates that the team would be able to get through everybody who was already on site yesterday evening, but it became apparent that that wasn't going to be possible. The team did work through until around midnight. The last swab was taken just before midnight last night, and the team worked well beyond that to close down the site after the last swab was taken. So I do want to remind people that, you know, our team out there doing the testing are human. There's not an infinite number of them. And at short notice, it's hard to get a whole enormous surge workforce in, but we will continue to increase testing capacity today. I want to thank the team very much for the work that was done yesterday to stand up the Brindabella testing site ahead of what we had scheduled. We already had the planning underway for that, but had to bring that forward. And the team did an amazing job to be able to open that facility yesterday. Today, the gates were open at EPIC at 7 o'clock this morning, and testing started at 7:30, and at Brindabella Park at 8 a.m, and of course at Western Creek as usual at 7:30 a.m. As of this morning, the estimated wait time at EPIC was about 6 hours for those who were in the queue, and at Brindabella was about 4.5 hours. And I understand that wait time may even have lengthened at EPIC. So a reminder, as the Chief Minister said, to ensure that testing is being prioritised for those who really need to be tested. And if you do need to be tested, if you're going to one of the drive-throughs, please remember to take some water and some food and some entertainment for yourself. We have asked for support from the Emergency Services Agency, the SES. They're very supportive and have sent people out to help to support the people who are waiting out there, and we'll continue to do that work to find more people to provide that support. For people who are looking for an alternative, we do also want to remind people that Capital Pathology also has COVID-only collection centres available in Ankertel Street in Tuggeranong, at Crace, Holt, O'Connor and Woden. So across the city, you don't need a GP referral and you don't need to call ahead, and all ages can be tested, whereas at the drive-through, children can't be tested at our drive-throughs. So please have a look at the Capital Pathology website for some more information about that. We're also continuing to work with the Commonwealth to try to expand the capacity of their existing respiratory assessment clinics to do tests on an appointment basis. So again, we thank all the staff for the hard work that they're doing out there, and we thank everyone for their patience. This is exactly the same situation as every other jurisdiction has been in on the first couple of days of an outbreak. No jurisdiction has been able to ramp up testing capacity to meet the demand that they see on the day or the couple of days following a new case and a new outbreak. But we're working very, very hard and looking at every opportunity to pull resources from other parts of the system to ensure that we can increase testing capacity. I want to say a couple of words about visitor restrictions at our places where we have vulnerable people. So at our hospitals, community health centres and walk-in centres in particular. As of 5 p.m. yesterday, no visitors are permitted to enter health facilities unless in exceptional circumstances. So for compassionate reasons such as end of life and birthing and paediatric care, and if someone needs a carer to support them, obviously that will be perfectly okay. The decision to restrict visitors to our health facilities is always a difficult one, but it ensures the health and safety of everyone, staff, patients, and the visitors and families themselves. This is especially necessary to protect the most vulnerable people in our community, particularly patients whose health is already compromised. It's also necessary to protect the ongoing capacity of our health system, and we've seen the impact when there's been cases in health services in other jurisdictions. Family members and friends are obviously strongly encouraged to maintain contact with patients through telephone and video calls. And anyone who is coming onto the hospital site is reminded to maintain all of the COVID-safe behaviours and to ensure that they do use the check-in, which is a different check-in, the ACT Health app site to make sure that you meet all the criteria for actually entering an ACT Health site or another health site across the community. There is a digital screening tool that is available on the app and also on QR codes as you enter a health facility, and it will give you a green tick or a red cross to tell you whether you meet the criteria for entering the facility. So please do take that seriously and abide by all of those restrictions. We know it's hard for people and we thank everyone for their patience and cooperation. I just wanted to finally touch on, we've had quite a few questions about essential services and businesses. There's a lot of information on the website about what essential services and businesses are. But we also know that individual businesses are going to have to do a bit of work to understand which of their workers are actually essential to undertake face-to-face activities and which can work from home. And so we really thank all the employers and the community organisations as well as businesses across our community who are doing that work with their staff to understand who needs to come to work, who can work from home and how they're going to manage their operations during this lockdown period. We had a very well attended webinar with community sector non-government organisations yesterday afternoon with the Assistant Minister for Families and Community Services and Disability Minister Emma Davidson, with the Deputy Chief Minister and myself, just talking through what is an essential service from their perspective and some of the questions that they had. We'll continue to communicate both the ACT Health Directorate and the Community Services Directorate with them. And of course, our economic development teams will continue to work with business. Major Projects Canberra and the team have been working with the construction sector through their questions as well. So there's a lot of communication going on with businesses and organisations. And again, we just ask for people's patience, understanding, common sense and kindness while we continue to work through this. And we recognise that this is difficult for everybody, and we thank everyone for their cooperation and collaboration. And with that, I'll hand back to the Chief Minister for questions.
So thank you, Rachel. I understand the media are aware I'm under some time pressure as I'm due to a National Cabinet meeting, so we'll get straight to questions for me and then questions for other ministers, and the Chief Health Officer can follow this section for questions for me. So Harry, you're starting first.
Chief Minister, one case triggered this lockdown. What are the goalposts to end it?
Well, we would want to see no additional community transmission. We're going to get back to zero. That's the objective through this process. We want all new identified cases to have been in quarantine for their entire infectious period. That's consistent with the best practice that we've seen in other jurisdictions. It is achievable. It has been done in Queensland and in Victoria, and so we believe that's an appropriate response for the ACT. This side.
Is the ACT any closer to understanding how the first case brought COVID to Canberra, and is any investigation underway as to whether that may involve a breach of COVID public health directions?
We're still working through the details there. We anticipate having some further information in due course, but as we touched on this subject yesterday, our focus right now is on ensuring we get information that can inform the community about potential exposure sites and that can allow us to identify close contacts. That's the most important thing now. There will be time to examine the backstory, the history and how this came to being, but right now that's not the most important thing. The most important thing is what we can do today, tomorrow and over the weekend to ensure that we get to the close contacts, get them in isolation, particularly people who are testing positive, so that they are not a risk to infecting more people in the community.
Chief Minister, a couple of quick questions. First of all, half of Canberra is talking about the fact that this guy was a nightclub bouncer who travelled to Sydney. Now, if that's not the case, can you put that to bed now?
I'm just not in a position to comment on that. As I say, we will address those sorts of issues later, but that is entirely unimportant at the moment because it will do absolutely nothing to address the situation that we face today, which is around identifying close contacts, testing the people we need to get tested and advising of the exposure sites. So there's a time for those issues, but not today.
My second question was around, given New South Wales' apparent unwillingness to implement a ring of steel around Sydney, is that something that you're talking to your New South Wales colleagues about now, say with a bubble including Queanbeyan, that at the very least would block, say, the roads to Cooma, or sorry, have roadblocks at the roads going to Cooma, Braidwood, Yass and Goulburn?
Look, again, not the immediate focus right now. We've got our own lockdown and our own issues to manage, but undoubtedly as we chart a path beyond the current situation, those issues around what happens inside New South Wales that are beyond my control. I can't put in place blockades in New South Wales. That's a matter for the New South Wales government. But rest assured, all of these issues, and it's not just about the ACT, it's every other state and territory as well, are regularly being raised with the New South Wales government.
Have you had any conversations with your New South Wales colleagues? I believe we've put in place that there are specific postcodes that can enter the ACT from New South Wales, and then there was a little bit of confusion, I guess, from New South Wales in regards to those people entering the ACT. Have you had any conversations? Yes.
So officials have been working to resolve that degree of confusion. There was something released late last night that wasn't absolutely clear. We are asking New South Wales to just be a little bit clearer in relation to their requirements for people who need to come into the ACT because they're essential workers or they need to access healthcare or for a legitimate reason. So the overarching thing we want here is less cross-border travel. We just want less movement of people, full stop. But we do need a clear and facilitated pathway for essential travel. And we're working on that with New South Wales. We hope to have that a lot clearer for everyone, but it really, I think at this point, needs clarification on the New South Wales side. Ian.
Is there any opportunity for an acceleration of the vaccination program for Canberrans?
Well, look, we've got surplus AstraZeneca, so there's certainly opportunity for people who wish to get vaccinated to do so through the GP network, through the pharmacy network. We have obviously a very heavily subscribed Pfizer program through our mass vaccination clinics. The vaccine rollout is on the agenda at National Cabinet, which is 29 minutes away, so rest assured it will be being discussed, and if there's any further information that we can provide in terms of additional vaccine supplies, then whatever we can do, we will endeavour to do. We'll be looking to partner with GPs, with pharmacists, with the broader health network in order to facilitate more jabs in arms as soon as possible.
Sorry, you're looking to add Moderna to the
the advice is that we'll start getting Moderna in September, and so we're awaiting advice from the Commonwealth on how they intend to make that available. Once we have that information, we will then factor that into our program. and the ACT-wide vaccination approach, which, as I say, includes GPs and pharmacists.
A number of the new exposure locations in close proximity to a healthcare facility and also a school now as well. How concerning is that?
Look, every exposure site is concerning, but clearly the situation that we are now in requires our utmost attention at this time. And that is why we are principally focused on dealing with these matters as opposed to some of the other issues that I understand people want answers to, but we need to respond to those issues right now, which is what we're doing.
Likely we'll see far more cases.
Look, I think the pattern of outbreaks across the country indicate that there would be an expectation of further cases. What we are seeking to do is to get to them first. The lockdown helps because it means most people, nearly everyone, should be effectively at home and not at risk of infecting other people. That's why I reiterate my very clear advice to stay at home.
So just ask on testing, Chief Minister, there's about 2,000, I think you said, was the figure overnight. Your Minister said that that number will rise, but that's the equivalent of around 25,000 or 30,000 a day, say in Sydney or Melbourne. New South Wales or Victoria. They're doing up towards 150,000 a day. What figure would you like to see the ACT reach?
Well, look, New South Wales is about 20 to 25 times larger than the ACT. So, sure, yep. So you would need obviously to do the jurisdictional analysis there to reduce the number here. But we would anticipate between 2 and about 5,000 would be the sort of range. But I expect today will be well over 2,000.
But on a proportional basis with Sydney, I mean, you'd be looking at 10 to 15,000 a day.
No, we would not have the capacity to do 10 or 15,000 tests. I mean, we've got 430,000 people in the ACT and 340,000 adults, so we're not expecting to test 5% of our population in one day. 5% of New South Wales would be 500,000 people or thereabouts. They're not testing at that level.
Just back on vaccinations, would you look at opening or expanding the eligibility of the government's AstraZeneca clinic to younger people?
The government clinics, no. We're focusing on the cohorts there. A mass clinic is not the appropriate environment for a detailed discussion between a patient and a health practitioner in relation to their individual health status. So the AstraZeneca program is available for over 60s at our mass vaccination hub at Calvary, but it is also available, and appointments are, I think, on a walk-in basis even amongst GPs and pharmacists. So if someone wants to get vaccinated today with AstraZeneca, the appropriate pathway is through a GP or a pharmacist.
That's it for the Chief.
Thank you.
Probably won't Karen, but I'll come up anyway, just in case.
Health Minister, on testing numbers, we've seen this coming for some time, particularly with the situation in Sydney. Why is now testing ability able to keep up with demand at this point?
Oh, look, I think what we've already seen is yesterday we took more swabs than on any previous day, and we've had these surges in demand before. And to go back to the comparison question, I remember a few weeks ago when New South Wales thought 40,000 tests for them over the whole state was a good number, and that's what we did yesterday. Equivalent, they're about 20 times our size. That's the equivalent of what we did yesterday. But they have continued to ramp up, and we will continue to ramp up. But as I've said before, no jurisdiction in the first couple of days of an outbreak has been able to surge to meet the entire demand for testing because we're talking about human beings who have lives, who need to come on to shift to do that work. And so while we've had a lot of planning in place to surge this up, it's very, very difficult to do that kind of surge in a very short space of time. But as I said earlier, we did already have the plans to set up the Brindabella Park facility. We brought that forward. We managed to open that yesterday. And if I can find my numbers, that site, I think, did almost 400, more than 300 tests yesterday in a very short space of time of being open, and Epic did 880 tests yesterday. So, You know, we will continue to ramp up our resources. We will continue to staff. As I said earlier, we will continue to seek to draw staffing from the Health Directorate, where we have, for example, nursing staff who are working to implement the digital health record. We're identifying those people who might be able to go back to frontline services. We're asking for help across Calvary and across the private hospital network for additional staffing. So we had our own surge staffing arrangements in place. We have surged up quite significantly, but we will continue to do that. But it is unrealistic to expect that when you have thousands and thousands of people all wanting to get tested on the same day, that we're necessarily going to be able to move everything in the blink of an eye to do that. But we have had plans in place. We did surge up yesterday. We did more swabs yesterday than we've done before, and we will continue to increase that capacity. And I just again thank all of the staff who've been doing that, and all of those people who are waiting in line for their patients. And I do apologise that people had to be turned away, but we have seen this in every jurisdiction when there has been an outbreak.
Just to follow on that, my apologies. Is there plans for additional testing centres, or will you simply expand the capacity of the existing ones?
No, we are planning for additional sites, and I think Karen might have something to say a bit more about that, or Minister Berry? Particularly in relation to the Gold Creek situation. So obviously we've got a lot of people affected by that situation. I was just filling in time.
Oh, okay. So was that a question for testing for the households engaged in the Gold Creek?
The question was, how is testing going to be expanded? Will there be additional testing centres, or will existing testing centres only be expanding capacity?
Yeah, so planning for a pop-up testing centre at Gold Creek for those households that are affected at the junior campus, the senior campus, the Holy Spirit Catholic Primary School, the out-of-schools hours care service, and the early childhood school, as well as the construction workers on that side. But it will be limited to those people, so it won't be available outside of that group.
Well, the Education Minister, we've heard for some time that planning has been underway in case remote learning was required. Why then will it take a week before teacher-led remote learning will be available to public school students in the ACT?
Well, because teachers are professionals and they need the time to transition from face-to-face learning experiences to online and remote education. Some of that will include professional development for some teachers who haven't had that opportunity yet. Most have received professional development, but they've already had their teaching plans in place for the rest of this term. And so how that's transitioned online needs to be carefully considered so that we can ensure that young people and students in our schools get the best possible education, however it's delivered, whether that's face-to-face in a school or whether that's delivered remotely online.
Sorry, Minister, just to follow up on that, private schools and Catholic schools are going to remote learning from Monday. We've heard repeatedly about how the state system is ready for this. Apparently it's not ready. How does that work?
Well, it is ready, but again, we're listening and working with the professionals, with the teaching profession, about what's the best way to support them to deliver the best possible education remotely to our school students in the ACT's public schools. So on their advice, they've suggested that to take the time to do that right, to get the professional development for those who haven't received it yet, to make sure that all our systems are in place, and then to flip what has been planned for the next term, for the next 10 weeks of education in our schools, back to remote education. We're ready as far as we already have the remote resource library, which has been accessed internationally. It is an incredibly well-resourced internet resource library that has been accessed by everyone. When New South Wales schools went into lockdown, the day they went into lockdown, we had over 1,000 access clicks to that website alone. So we know it's been really useful, not just for here in the ACT. We have Chromebooks, which every other state and territory hadn't provided to their senior secondary students. We've additional Chromebooks for those students who need them. We've offered families who need it Wi-Fi access, and we have those available and ready to be delivered as well. So prepared as far as having everything in place, but making sure that the teaching profession has the chance to do their job to the absolute best best that they possibly can. We're going to give them the time to do that.
Sorry, Minister, my question was why can private and Catholic schools start from Monday and the state system can't?
Again, because we've listened to the professionals within our ACT public schools, and they've suggested to us that they need 5 days to do the best possible job at transitioning their education from face-to-face to remote education. These are professionals, and we want to make sure that the experience of our young people in our schools is the best it can possibly be, whether that education is delivered face-to-face or whether it's delivered remotely, as it will be.
Minister, the student at Gold Creek, has the student caught a bus in that time? And do any of the siblings of students at Gold Creek go to other schools?
So these are all part of the ongoing assessments and investigations that are happening following the test results coming back positive, and those investigations will continue. As far as whether or not that student's caught a bus and there might be somebody else who's a secondary or a casual contact, those will be part of the continuing investigations that are occurring with ACT Health.
Question for the...
I've had a question for the Chief Health Officer. With the additional cases announced late yesterday and overnight linked to our first case, can you give us some more details about them? Were they family members? Did they live in the same house as this man? How close were these contacts?
So, look, I don't have specific data. As you can imagine, that's quite a large number of cases in a short amount of time, but they are definitely all linked to the primary case. That means that they have either been to one of those close contact sites or also a household contact.
So you don't know where they live?
I know the team knows where they live, but I can't talk to you about where they live today.
What's your advice for a young Canberran, perhaps an essential worker, who's eligible for Pfizer as recommended? Is it time for them to get AstraZeneca instead?
I think this is one of those things that it's important to talk to your trusted health professional about, and it might depend on your risk of exposure and also your underlying current health status. This is certainly the time to be starting to take those vaccination considerations very seriously if you haven't already.
Has the genomic sequencing of the first case come back, and has that told us anything about where it's come from?
So we've confirmed through the genomic sequencing that it is the Delta strain. We have not got the additional detail yet on the specificity of that. We're still waiting on that.
How excited should Canberrans get that we did only have 2 cases today?
I think it's still very early in our investigations. I think it's what I'm excited to see is how everyone has responded to the requests that we've made of the community to take this really seriously and to do the right thing. I know driving in this morning, and I had to stop by the lake to do a radio interview, and I was very impressed with the people who were doing clearly their 1 hour of exercise, but doing it very safely. So look, 6 cases in a 24-hour period is very concerning, and I'm glad to see that the community is not becoming too alarmed about that, but continue to take that seriously.
Do we have a total number of close contacts for our cases at this point? This morning it was over 3,000.
Yeah, so the contact situation will continue to evolve, so it's very difficult to give you hard and fast numbers on that. What we know is that the over 3,000 number was the preliminary number of contacts that we got from the Check-in Canberra data when we looked at the first round of sites that we had yesterday. What happens after that is that when people go onto the website and they fill in the form that tells us when and where they were, we work through that data to identify whether they are actually confirmed as a contact or not. And the data that we have in the media release going out today that the Chief Minister mentioned this morning is those that we have confirmed as close contacts, as contacts. So this will be an ongoing process, and we will just need to be continually seeing those numbers climb.
Just a question regarding the 1 hour rule outside. Had a few punter questions as to why it's in place. Can you just sort of explain the methodology behind it?
I think all of this is about reducing the risk of mixing and exposure to undiagnosed cases in the community, while also acknowledging that both our physical and mental health are really important. So that one is a balance of the time period and looking at most people probably exercise for an hour a day. So that's where that comes from.
Doctor, I thought the Chief said earlier it was something like 3,900 close contacts in total. Given, I think that was the figure, apologies if it's not, given that, I mean, that's a very high figure in a small jurisdiction in Canberra, what's your best estimate about whether, given that fact, given the likelihood of more cases in the next few days, your best estimate about when this lockdown ends? Like, surely it seems likely to you that it'd be more than a week that we'll be in lockdown here.
So just to clarify, the 3,900 are the ones that I'm referring to in terms of the sweep from the check-in CBR app. I think, what's in the numbers today? 1,800 have been confirmed as contacts from that process. But you are correct. For a small jurisdiction, in addition to the people we have currently in quarantine from COVID-affected areas, this has a big impact on a small jurisdiction. We are also looking at 1,500 to 2,000 people impacted by the current Gold Creek School and Holy Spirit Catholic School incident. So we're looking at getting around 2,000 people through that pop-up clinic that we're looking at out there. But we will get there. We are prepared, and while it will take us a little while to ramp up, as the Minister's talked about, this is the same experience everywhere. We just need people to have patience with us. But I do need people to realise that this is serious. We will be reassessing early next week based on the results that we are seeing, how far this has spread, how much risk do we still think is out there in community, and we will be endeavouring to get the community an answer on what we're going to be doing early next week beyond Thursday.
But just to my point, how likely, given these numbers, do you think a second week is?
It's the second day. It's impossible for me to give you a likelihood estimate, but it is concerning.
Can you clarify for me that the student at Gold Creek is not linked to the other cases? Is that correct?
At this point in time, it doesn't appear that they are linked to the other cases, but that case interviewing process is continuing. That is why we are actually sending that student's test sample off for whole genomic sequencing as well, to see if that can assist us to understand if we've missed a link here somewhere in the community.
And what is the condition of these people? Are they all at home?
Yes, none are in, well, they're either at home or in our isolation apartments. None have needed hospitalisation.
As yet.
As yet. If you remember from the first wave, the second week of illness can be the one where unexpectedly some people become quite sick, and that's where we have seen some of those poorer outcomes. So I would encourage people who are ill just to keep a very close eye on themselves.
Will you be updating number of cases later on this afternoon if you know more?
Look, our aim is to do this under a regular reporting cycle moving forward. So we have a 9 a.m. cut-off for data, and we will be doing press conferences or a media statement every day at around the middle of the day moving forward. If there is anything important that the community needs to know in the afternoon, we will come out to you. But we need to get into a regular rhythm in this. This is going to go for a little while yet, and we don't want to be popping out information here, there and everywhere. So I can commit to letting you know if it's important and it has an impact on what other people need to do, but I won't commit to letting the community know every single time there is a new case that pops up until we are at a position to let you know more about it.
Pregnant women are being told they can't get vaccines until October, even though they're in phase 1B. Given the current circumstances, will there be a directive that they should be given appointments as soon as possible?
So pregnant women are one of the group of people in 1B who are a priority population, but we have appointments in October. It's not that they're not a priority, it's just that is when our next appointments are.
So should they be given appointments ASAP?
They're getting the closest appointments that they can.
And for people who are waiting for their second AstraZeneca appointments, can they pull those forward?
So they can within the current recommendations. The advice is firmly that if there is not a current threat of an outbreak, that 12-week period gives us the optimal efficiency of the virus. At this point in time, I'm not making a formal recommendation to people in the ACT to pull that forward, but if people would like to discuss that with their GP or their healthcare provider, then that's certainly possible within the current recommendations.
People have been turned away from testing sites yesterday after waiting for upwards of 8 hours. Are you worried that, given that situation, some people simply won't come back for testing, and does that put ACT Health on the back foot in identifying potential cases?
I think it's very important that people know that that when they get tested, that we will test them. It may take a little while, and I would encourage people to do what they can about assisting us in getting those prioritised. Please don't go away and not come back. Please come and get tested. As I think the Minister has talked to at length today, we are doing everything we can to supplement that testing capacity, but we are all humans in this community. You have to know that we are all trying to do our best. None of us are trying to stop somebody getting tested. We are trying our absolute best to get you your test when you need it. Please have a break. Please give us a break in this. We're trying our best.
So in that instance, when would you like to see an extra testing site set up? How important is it that it's done as soon as possible?
It's very important. We're working very hard at it. Our priority today is to get Gold Creek students tested as early as we possibly can. Thank you.
Just one for the Health Minister, if that's okay. Is it possible to add the waiting times for the drive-through clinics to the ACT Health app, as is done with EDs and the walk-in centres?
It's actually quite hard to do that. So the way that the wait times work on the ACT Health app for the walk-in centres and the emergency departments is it's based on how long the last person treated waited. So what we're doing when we provide those estimated waiting times, as I just did earlier today, and as we will try to do that throughout the day just to give people a bit of an idea of it, but it's based on what the staff out there are seeing in terms of the length of the queue and what they know in terms of how many people can be processed over a period of time. So we'll continue to try to provide those updates to the community, but our priority at the moment is not putting it on the ACT Health app because there's just so much going on, and that would be quite a significant piece of work for our digital data team. I would also say that we have, as I mentioned earlier, the Canberra Health Services has been working with the Emergency Services Agency and SES to get people out to the testing sites to support people who are waiting, to make sure that they have better access to that information while they are waiting. So we have definitely heard the message that people are sitting in their cars being a little frustrated that they don't know how long they're likely to have to wait. And they feel like maybe they can't leave their car to go to the bathroom, etc. So we're trying to put that support in place and some visible people in place to ensure that people can get that information from a friendly face. And there's probably going to be more people doing that over the next few days. We just started that this morning, but I've certainly had feedback already from people in the queue that those people aren't super visible at this point in time. We are continuing to work on that. We're continuing to address the feedback that we're getting from people.
All right, we'll leave it there.
Question for the Chief Police Officer.
Yeah.
Chief Police Officer.
Minister, before you go,
Yeah.
when could we see the Southside Testing Centre that you've already indicated will be stood up?
So as Dr Coleman indicated, today our priority is getting set up at Gold Creek to ensure that the Gold Creek school community and those other communities that Minister Berry spoke about can be tested as a priority. So we have provided the information to people about capital pathology on the south side, and we are continuing to work towards the development of a south side testing facility as well. But our priority today has to be that known case and the people around that case, because that's where we really need to identify whether there are other contacts who are going to test positive and make sure we break those chains of transmission related to that particular case.
Would you consider adding Goulburn, Braidwood or Cooma to the exemption list?
No, but what I would say to people who are in those areas and commute to the ACT for essential work is that there is an exemptions process in place, so you can still apply for an exemption, and you can, if it's it'll be processed through that broader exemptions process, but Standing exemptions can be provided through that as well, so people don't need to apply for an exemption every day to enter the ACT, but it's just not through the standing exemption process, it's through the broader New South Wales essential workers exemption process. And our exemptions team, look, that gives me an opportunity. I just do want to give a bit of a shout out to our exemptions team. They are incredible. They have worked so hard over the last few months as we've had varying requirements across a number of jurisdictions, people requesting exemptions for all kinds of things, and they are incredible at processing those, understanding people's individual circumstances and responding accordingly. If you're waiting for a response from the exemptions team, it's probably because somebody else needs a response more urgently than you do, but they are doing their absolute best to process exemptions as quickly as possible in this very high demand environment. I'll hand over to Neil.
Thanks, Minister. Good afternoon. Harry?
Has anyone been found to be in breach of the current health orders yet, and have any penalties applied?
Well, obviously, ACT Policing has been doing this compliance for well over 18 months, but in relation to the actual direction that was issued by the CHO the last couple of days, no, there hasn't been. There's been a few people spoken to in relation to their behaviour, but this is a pretty fluid environment, to be honest, and we'll continue to work in construction industry and things such as that. I think it's also important to note that things have changed a little bit in relation to ACT Policing's posture. We will be working with the community to ensure compliance education. We will be helping them. I think the other thing I want to quickly pass on is that we have made some slight changes to our police stations in that they are shut for the public for all intents and purposes, but people can still go to them, but you'll just have to buzz yourself in. I think it's really important to actually state that another reason people can leave home is if they don't feel safe. So if you don't feel safe at home, please go to the local police station, buzz on the door there, we'll let you in, and we'll actually be able to assist you in relation to the issue you're facing.
Will we be seeing stricter patrols on the border, or are you happy with resources as they are at the moment?
So we'll continue with an anytime, anywhere approach, in that ACT Policing will be in a position to stop any car at any time in relation to compliance. The other thing I will say is we have been in contact with our New South Wales Police colleagues, obviously regularly, but certainly over the last 24 hours. People will see a fair amount of activity on the border with both us working together early next week to ensure compliance, because we've got to also note that there's compliance checks in place for New South Wales for ACT residents, in that we're declared a zone here for New South Wales. So that will continue. We'll keep you informed in relation to when that happens. But at this stage, I've got to thank Canberrans for their compliance in relation to the health orders. The vast majority of people, as they have throughout the last 18 months, have done the right thing. And we encourage people, when they're asked questions by ACT Health, to be honest in relation to where they've been, so we can do the right thing, which is protect the community from this coronavirus.
Are police investigating whether there was a breach of COVID directions that led to the first case being identified in the ACT?
I think it's fair enough to say that what I want to encourage Canberrans to do at this stage is be honest and be open with ACT Health when they're contacted by the tracing team. My priority at the moment is to actually work with the CHO, the Chief Health Officer, in relation to the current direction, which actually enforces certain activities on the ACT community to cease. We have active cases in the community, as we've been speaking about today. So my priority at the moment is to ensure that people in the ACT adhere to the health direction. That said, and as the Chief Minister said earlier this afternoon, over time we will look at whether or not there has been any breaches by any person, and I'm not going to talk about individual cases. We have breached people for going to different jurisdictions during the last 18 months, and we'll continue to do that. But the priority at the moment needs to be the security of the ACT community and making sure they actually adhere to the direction issued by the Chief Health Officer.
So is that investigation underway or not?
I'm not going to commit one way or the other in relation to, we've got a lot of inquiries underway. I see that there's a lot of focus on one individual. I think that's really dangerous. It's not a kangaroo court. There are offences under Commonwealth legislation in relation to naming people on social media, so I ask people to be very cautious about what they're posting. We will continue to work as we can in relation to identifying people that breach the orders, but I'm not going to speak about any individual cases.
Officer, New South Wales and Victoria have at various times talked about throwing books and so forth at individuals who've breached public health orders in those states. Is that something in the future you could anticipate ACT Policing also doing?
Well, ACT policing have been enforcing the COVID directions since the commencement of the coronavirus pandemic, and we'll continue to do that. People have been arrested, people have been fined, people have been turned away at the border, and that will continue. I'm not going to use terms like throw the book at people, but if people are in breach of the health order, as we've been doing for the last 18 months, people will face the courts or they'll be facing a fine.
Have you had to turn back Canberrans trying to get out of the ACT since 5 p.m. yesterday?
No, we haven't. And I can't speak for New South Wales Police around what their actions have been in relation to Canberrans who have tried to leave the territory. And that's a matter for New South Wales Police. Thank you.